Oregon Health and Science University presents a resource for health science educators. Profiles of health science professionals with disabilities. A dentist with a physical disability. Billy Holbrook, DMD. Dr. Holbrook has been a dentist in private practice in Arizona for over 17 years. She graduated from the University of Oregon School of Dentistry, now the Oregon Health and Science University School of Dentistry. She received her degree in dental hygiene in 1973 and worked as a hygienist for 8 years before pursuing her DMD. In 1969, while in the Andes as a Peace Corps volunteer, Dr. Holbrook experienced the growth of abnormal blood vessels around her spinal cord, which left her with partial paralysis in both legs.
This is the Stephen A. Peglow Award that I got when I graduated from the University of Oregon in 1985, and I'll read it to you here. It says, Billy M. Holbrook in recognition of her qualities which epitomize the ideals of the profession, and it was given by the faculty and students of the dental school. So I worked as a hygienist after I graduated from dental hygiene school for 8 years. I moved to Arizona because I was at that time in Maryland, in the hills in Maryland, and I had braces and crutches. I came to Arizona because it was flat and I wouldn't have any icy driving around, and got a job here. After 8 years, I came to work on April Fool's Day, 1979, and the office had burned down. So I was taking continuing education classes at the time to further my hygiene career, and I decided to just point that in the way of going into the dental school. When I first got accepted at Oregon, I didn't even tell them on my application that I was going to be coming in a wheelchair. Then I thought, well, I better warn them, and the dean of the school got in a wheelchair. When he found out, he got in a wheelchair and he wheeled around to on each of the floors of the dental school. He even went into the ladies' restroom and checked to see if it was wide enough or where there were barriers. The facilities people were excellent. In anatomy lab where we were working on cadavers, the cadavers were on a gurney that was almost at my eye level. I mean, I could not look into the stomach of a person on the gurney. So they rigged it up so that I could have a mirror that would look down on, there was like a tall mirror that came off of the gurney, and then I could look up into the mirror and see what was down inside the cadaver. Well, then I would see everything the opposite of what side of the body it was on. So that was really confusing for me. So I thought, so then they gave me this high rolling stool that my colleagues would help push me around, and I would be high up so I could see inside the patient's the cadaver. In microbiology lab, the lab was also on high benches, and so they made me like a little rolling card table, like they do for little babies, where you kind of it fits around them, and then they can't, drop any crumbs on the floor. So this would be my place. And then there would be tests where you'd go from station to station that were up on the benches. Well, then they would have to take the microscopes and bring them over to my little cart to look into, so I could look down into the microscope from my chair position. Then we also tried the rolling chair in the microscope lab too, microbiology lab. It didn't work as well. There are foot controls to run the wash stands, when you wash your hands. And I would have, so they made me a ramp so I could ride up on the pedal to push it down. So I was like leaning back while I was trying to wash my hands while I'm leaning on this ramp to push down the pedal. And now, though, there are a lot of things that are great. And I had one here was the infrared faucets for washing. So you don't have to contaminate anything when you're putting your hands under the water. And that's a good adaptation, I think. And water fountains now don't have foot pedals, they have the hand press. I knew that there were ways of making hand controls, but for the first 2 years and maybe the first month or so that I was on the clinic floor working on the actual patients, I used the foot control. I'd either press down on it with my hand or with my elbow in the labs where we worked on typodont teeth, or when I went to the clinic, I would have my patient push down, hold the foot control in their hand and push down to run the drill. After the patient was trained into high, fast and slow speeds, I finally got, and was donated to the school, ADEC gave a set of hand controls for me to work with. I don't think I have anybody that hasn't accepted me as an equal professional in my group. I'm on the board of the Southern Arizona Dental Society, and I've served as a delegate to the State Dental Association, and I've been on several committees, and I was always active, kind of politically as a hygienist and also as a dentist, and I've never felt any problem with discrimination. I have friends that call me up for advice about clinical problems. I feel like in some ways I've been a mentor, and I've been a mentor too to we have Expanding Your Horizons is the name of a group here at the University of Arizona that tries to encourage junior high girls to go into the medical and dental professions. And so I've been mentoring to those girls. I have had a couple patients that felt that because I'm wheeling around and coming up to them, they feel that my hands are dirty from being on the chair tires. But I put the gloves on after I park the chair next to the patient. So I try to explain that to them, and maybe they feel that the place is not as sanitary, but we have state-of-the-art infection control at my office, and I have a wonderful staff. I've heard sometimes when my receptionist is the one who's usually the first contact with the new patients, unless they've been referred by somebody who has already seen me. And I think she tells just about everybody, or maybe they've heard it, that I'm in a wheelchair. It seems like it's no surprise to somebody when I come in the room. And maybe I could be just sitting on one of these little rolling stools that the dentist uses anyway. So once I'm parked in place, they see no difference. Actually, when I bought this practice, everything, the doorways were nice and wide. There was no curb cut for the first 12 years that I've been in this building. And then 3 years ago, the new landlord cut a curb cut and gave me a handicap parking place directly in front of the doorway to my office. This office, the only room I couldn't get into was the dark room. I used to park the wheelchair right about here, and then I'd hold onto the door jamb and swing around and sit down on the countertop here. And then we had a tank that we dip the x-rays in. That was until this year, my 15th year of practice. And the accommodations, we have computers and monitors in every room and a network, and we got the digital x-ray machine with a sensor, the sensors, so that I do not have to go into the dark room anymore to develop the film, and that's a big plus. Yeah, and I don't even have to, look at the film and hold it up to the X-ray viewing light anymore, because it was hard for me to get up close enough to the wall where the viewer was hanging. We have voice recognition on one of the computers, so that we do the probings, when I was calling out those numbers. And when my hygienist does it, she can record it, and somebody doesn't have to be there to write it down. It's just taken down on the computer. So I think because of technology, not because of, maybe dentists are kind of into gadgetry too, it's getting a lot easier to do the actual clinical work in dentistry. My lab, I don't have any kind of a foot control in my lab. I have a lathe that just has an on and off switch. And so I do my denture adjustments. These are my lab cases for crowns that need to be seated. They're in these boxes. And then I work on the lathe here. I can make temporaries. There's another machine there for making temporaries, and here's the sterilization area of my autoclave in the Statum, which is a fast steam sterilization process. Here in my own practice, there are foot pedals for the intraoral camera, and I got an infrared remote control to run my intraoral camera to take pictures of people's teeth in their mouth. My hand control is this little watch. It's looks like a little watch band in a head, and then it's a rheostat right here, and I use it between my index finger and middle finger, and then I hold my mirror with that same hand. I think a lot of dentists, they lean, the patient's head is almost like between their knees, but I have to sit up higher.
How does that impact the angles whenever you're doing it?
It's not the way, I had to kind of learn how to do it this way, because I can't straddle the patient like any other dentist can. So I kind of have to twist around differently with my back. I was taking a course on a new way of making dentures, and the professor that was teaching it, well, it was actually a colleague of mine here in Tucson, came and helped me make a set of dentures on a patient in my office. And part of assessing how well these dentures are working was to stand up and look directly on at this patient. Well, he then taught Alva, my assistant, how to look at the patient and what to evaluate, and then interpret that to me. I work on the HIV population in Pima County, and that I wanted to do, and I was so surprised that no other dentist wanted to apply for the grant when it was originally that Ryan White money was available here in the county. Because I would think that everyone has that Hippocratic oath that they serve others. But anyway, I opted to do that, and I really enjoy making people feel comfortable, the HIV people in my office, and helping them out. And I've learned a lot about how to help them and what their needs are, and it's broadened my horizons. Now, say I'm in a different environment. For example, say we're at another kind of social gathering, and people will ask my husband what he does. But they won't ask me because they think that I probably am not employed. And so, I'll try to find some way to kind of fit into the conversation that I'm a dentist. I think it's fun when I'm on an airplane, because say I'm already seated on this airplane and somebody comes and sits down beside me, and they don't know that I got there in a wheelchair or with an aisle chair. And so they'll start a conversation, and then they ask me what I do, and I feel like I don't have to tell them anything about the disability.
Health Sciences Faculty Education Project, a resource for health science educators. Project staff, Project Director, Joanne Sowers, PhD. Project Coordinator, Martha R. Smith. Dissemination Coordinator, Lisa Ferris, M.E.D. Project Administrative Assistant, Tina Campbell. Additional support provided by Clark Hochstetler, M.A. Narrator, Z. Boone. For project information, please contact Martha R. Smith, Center on Self-Determination, Oregon Health and Science University, 3608 Southeast Powell Boulevard, Portland, Oregon, 97202. Telephone 503-232-9154, extension 131. Email smitmart@ohsu.edu. These videotapes were partially supported by grant PR/3P333A900-51 from the Department of Education, Office of Post-Secondary Education. Copyright 2002 by Joanne Sowers and Martha R. Smith. All rights reserved. No part of this material may be reproduced, stored in a retrieval system, or transmitted in any form or by any means without prior consent of the copyright owners. Oregon Health and Science University presents a resource for health science educators. Profiles of health science professionals with disabilities. Dental professionals with hearing loss. Christopher Lafelt, DDS. Dr. Lafelt graduated from the University of Maryland at Baltimore, Baltimore College of Dental Surgery, and has been a practicing dentist for over 13 years. Dr. Lafelt currently works in private practice with 8 other dentists in Rochester, New York, and also at a rural health clinic. At the age of 2, Dr. Lafelt's parents discovered that he was deaf. Because his father was a diplomat, the family traveled and moved every couple of years. Dr. Lafelt went to an oral school for the deaf in England, where he was fitted with his first hearing aids and was taught to speak. Dr. Lafelt learned sign language when he was 19 years old and in college in the United States. Giselle Gonsaline. Ms. Gonsaline received her associate's degree from the National Technical Institute for the Deaf at Rochester Institute of Technology. She then went on to get her dental assistant certificate from the Continental Dental Assistant School in Rochester, New York. Ms. Gonsaline was encouraged to pursue a career in a medical field by Dr. Lafelt, who was her dentist. Ms. Gonsaline has worked as a dental assistant for Dr. Lafelt and Dr. Lamar at the Elmwood Dental Center for 4 years, and last year was voted Employee of the Year. Ms. Gonsaline was found to be deaf at age 2. She went to public school and learned sign language from her friends in school.
You may asked me the question why I wanted to become a dentist in the first place. And as I said, I was in different countries growing up and would be out shopping with my parents, and I would notice that there were many people with disabilities on the street begging for money and food. And so I'd ask my mom. And she said, oh, they're disabled, they're blind, they're amputees, they have illnesses. I thought, can't they work? And she said, no, because of society's attitude, they've been rejected. I thought, really? Could this happen to me? And I think when I was probably 8 years old, I had the realization that these people who had disabilities, that this could also happen to me. How can I prevent this from happening to me? Education. Get the most out of your education, and no one can take that from you. So I realized when I was about 11 years old, I was quite a good lip reader, and that I could easily lip read people who had good teeth. And it was very difficult to lip read people who had bad teeth. And I thought, why don't I become a dentist? I can fix their teeth, and I'd be able to lip read them better. So I made that decision to become a dentist when I was 11. I entered Georgetown University in Washington, D.C., and I did not really tell them that I was deaf when I entered college. This was in 1979, and I went directly from the school in Britain to the American University. What a shock! Culture shock. It was American culture shock, hearing culture shock, because I grew up at a school for the deaf in England. It was a very small class of 30 students or so. And here I was in a university with 2,000 students in a large city. And also Georgetown University was next to Gallaudet University, which is a national university for the deaf in Washington, D.C. And I basically had what I would call a hearing mentality. I never really saw any deaf adults during the time when I was growing up in England. I thought, well, when I graduate high school, I'll become hearing. I had no role models, really. So I entered Georgetown University, and I saw that there were a few deaf people who used sign language. They attended Gallaudet University. They worked for the government. They didn't use their voice to speak. And so I decided that I would take some sign language classes at Gallaudet, which I did. So again, there was the American culture shock, the hearing culture shock, and then there was the deaf culture shock. So my first year went by very, very quickly. I had to learn really fast. I majored in chemistry and minored in math. And chemistry, there was a lot of lab work, and math, there was a lot of writing on the board. But I still wanted to become a dentist, and so I had to take pre-med requisites. And so I remember the teachers telling me, no, 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 you can't do all these things when I was growing up. So I thought I had to have a backup plan, and my backup plan was chemical engineering. So I got a summer core job at IBM in California, and I went. And I really enjoyed working in the chemical research lab. But there were no people. It was quite monotonous, mixing chemicals, collecting data, titrating, doing this over and over again. It was very boring. There was no interaction with people. And I thought, I don't want this kind of job for the rest of my life. I thought I'd better get back to career plan A. So I applied to dental schools. I sent out a few applications, and in the back of my head that voice was still telling me no, I would not be accepted because I was deaf, but I thought, nope, I've got to keep a positive attitude. And I went into dental school at the University of Maryland in Baltimore, and there were 5 people during the interview. And the room was dark. The lights were dim. So I went in and said hi, introduced myself, and they introduced themselves to me, and I lip read their names. And I said, excuse me, would you mind turning on the lights so I can see your faces better? And they said, oh my God, oh, I'm sorry, we forgot, oh my God, oh. And I said, don't worry about it. This happens to me all the time. And we made this situation fun, and it was the best interview. These 5 people just asked me all kinds of questions, and then after the interview, this one person came up to me and said, I'm not supposed to tell you this, but we are going to accept you in this school. We want you here. And that school was so cool because from day one, the professors were accommodating. They said, how can we help you? Follow us in the classroom. And I said, geez, I don't know. I've never been to dental school before. We laughed about that. But the first day, I approached all of my faculty members one-on-one and informed them of my needs and what my limitations were. And we really learned as we went along, and that was 1983 through 1987. And my first year, boy, was that tough, especially histology and anatomy. The first semester, they had this slide presentation in this dark room. So it was just these slides coming at you really, really fast. I could see the light flashing from the slide projector. And there was this red light that the professor was using to point to various things on the wall. And so all I saw was these flashing lights and this red light pointing on the walls. And it was really black and white slides of various cells and body parts, and there was no captioning. And if I had studied the book beforehand, I might have been able to try to make sense of this in some way. I mean, the book was great. I could understand the book. But looking at these slides coming at me and this light flashing from the projector, it was like, oh my God. After class, I went up to the professor and I said, I really need some help with this. And in histology, they had lab work where we had to wear headphones and listen to a tape play while slides went by. And I couldn't do that because I'm deaf. I can hear noises, but I was never really able to discriminate sounds or put the sounds together in order to comprehend words. But the faculty there were so sweet and accommodating, and so I'd sit down with that faculty person and say, you know, you need to tell me what it is you want to say first, and so I can read your lips and then point to what you're referring to. So tell me what it is, what you want to tell me. Okay, thank you. And then I can look at the picture or the graphic or whatever it is. And then I can ask questions about that, and we can communicate back and forth that way. And that really worked great for anatomy and histology. I did ask for an interpreter my first year. Nope. They said we don't have the money, we can't find an interpreter. This was in 1980, 2 or 3 years before the ADA, the Americans with Disabilities Act, was even considered. And so we struggled over this issue. And it wasn't until my 3rd year of dental school that they even considered it. And by that time I was in clinical work. If I had to do it all over again, I would have had an interpreter from day one. And looking back, I think I studied 2, maybe 3 times more than my classmates. But really, the faculty was so wonderful, so supportive. I worked at the hospital for 2 months in the ER. Wow. And for 1 month, I worked with an anesthesiologist. And I would stand behind the patient during surgery, during open heart surgery, amputation, heart transplant surgery. I didn't do the work, but I was in the room and I observed what was going on. And I took measurements of oxygen, carbon dioxide, the IV drip, and I would have to collect data and would do that for 2 or 3 hours at a time. And it was a sterile environment. And the technology at the time required that you were not able to take off your gloves or face mask, etc. And so there was a plastic bag that would cover the paper. I'm sorry. Yes, the plastic bag would be over the paper, and then we had a pen. I think there was one company that made sterile pens. And so we would use that to write on the plastic. And then if you needed more quote-unquote paper, you would take a 2x2 gauze strip and wipe off what you had written on the plastic. And that's how the two of us would communicate. That's how I communicated with the anesthesiologist while I was a resident. And we would do this for 2 or 3 hours at a time, right back and forth, if there were any questions, etc. I applied to get my license in Virginia, Washington, D.C., New York, and Maryland. And they came up with this question: do you have any specific disability that impedes your ability to practice in your chosen profession? I thought to myself, hey, I've gone through dental school, I've graduated, I have my DDS degree. If there were any clinical experiences that were unsafe or dangerous, they would have prevented me from graduating. So I put down no. If they saw me fit enough to graduate, and I had all the required knowledge, I passed all the tests, I passed the boards. This is really an old way of thinking.
When I applied for the school, I did not tell them I was deaf because I was afraid they would turn me down. And when I met them in person for an interview, I told them I was deaf. And they were shocked. They said that they've never had a deaf person come to the school. And I said, well, I'm the first one. And they felt that I probably couldn't do the job. And I told them that I think I could, that I'm proven wrong. I didn't need an interpreter and note taking. And with the for about a year, graduated with top of the class, went to Eastman Dental Group, and here I am for my internship. The chairperson of the school informed the Eastman Dental Center that a deaf person would come in to work with the residents and the patients there. And an interpreter would be provided over there also. When I first started working for internship, there was, small problems. There were a lot of residents that didn't want to work with me because they were exciting and they were already nervous and they didn't want to deal with me. But, as they got to know me and, I told them, don't worry. As long as, I lived free and the interpreters were there. I had an interpreter during internship and they were fine. So.
Really, nowadays with email, it's so great. I ask every new patient who comes in if they have email and if I can have it. And I follow up with a message after their dental work. I'll send them an email and ask them how they're doing, do they have any pain with the root canal, and we can correspond via email. We don't have to waste time on the phone or with a relay service. And I give them my email and I tell them, feel free to email me 3, 4 o'clock in the morning. It's so great. Boy, I wish I had that when I was in dental school. I love that now with my patients. Deaf, hearing, hard of hearing. It's equal opportunity for both, for me and my patients. The first few months, I had some patients who were sign language interpreters. And they said, Dr. Chris, we don't have benefits. And I said, sometimes I have a need for sign language interpreters from time to time for dental lectures. In our private practice, we have doctors' meetings, and it's hard for me to follow group discussions. So would you like to barter services? And that's worked great so far. They and their families get all the dental work they need, and I get all the interpreting services that I need. It's a win-win situation.
and I would go in person to fill out the application. I never spoke to him over the phone because, I called them really late, didn't want the office or the dentist to think I was deaf because, they would never give me the chance. I tried that several times and it just, died. I was looking for a job and it took me a whole year. I filled out 50 to 100 resumes, cover letters, and sent them all out. Had like 2 or 3 interviews and felt like I was being discriminated against because I couldn't use the telephone. There was this one doctor that wanted me, but he was in his home, and I just didn't feel right working at his home. And I called the Dental Society Association of Rochester, New York, and they told me that there's a position open at my dental group. I called them, they said come in, fill out an application. I did that. Later on that night, Dr. Quickly called me. I told him the application all written up. Interview went 2 weeks later, and the interview was great. The office manager was really nice, and they offered me a job right there. And I've been working here for 4 years. And just last year, I won Employee of the Year. Usually support working with the doctor because we know each other very well and we know what it's like to be deaf. We understand our disability. And while working, we both have to wear masks, but we do sign. It's like working with thick hands, We're like, the other doctors, a little bit different. They have to be more patient with me. They put the mask down and point or tap me. They're very good. They're very patient. And the intercom, when they call the intercom to let me know patient here or there's a phone call, they have to say very clear because I have hearing aids. I can hear some things, but not often. A lot of secretaries come get me and let me know.
Give the person with a disability a chance to work with you. That's why today I have a dental assistant who is deaf. She is the best one in my 13 years of practice. It's telepathic when we're working together with a patient. She has told me she had applied for many jobs before she came to work with me. At those jobs, they would have to wear face masks. The hearing dentist would say, well, you can't hear me through the face masks and we can't hire you. It was obvious discrimination, but they would come up with a reason why not to hire her. Oh, we found someone who's better qualified. But I knew deep down inside that that was the reason. And also when I talk to my patients, I always remove my face mask, whether they're deaf or hearing. I just think it's better that way. It develops rapport, it's face-to-face eye contact. And I do all my communication with them before I begin my work. And with my dental assistant, of course, she can't hear me, but she can lip read. So I sign to her before we start doing any of the work. And then we put the face masks on. There's no talking during work. So we have a system that works great. The same thing with professionals in the future. You are a role model, and you will inspire people in their future careers. I can see why we, people with disabilities, need to experience the same things as people without disabilities. With the ADA, the Americans with Disabilities Act, There's absolutely no reason why anyone with a disability should not go to a health profession school and find a way to get around their problem, get around their disability, ask students, how can we help you to get a full education in order to become a doctor, a nurse, or a dentist? Of course we've done our thinking before we've made our application. If we thought we couldn't make it, we wouldn't bother applying. And if we applied, that means that we've already done our thinking in terms of this, and that we are ready to accept our responsibility. We would communicate what we need, what my limitations might be, what my needs are, and what it is that I want from you in order to help me to get my education. I think that having a student with disabilities, this person might be a very cool person. Really, the disability is one facet of their personality. Just like color, ethnic background, gender, age, etc. But putting that aside, these are individuals with unique backgrounds, makeups. And I think that having a student with a disability, in terms of future colleagues, they'll become future doctors, nurses, future dentists, who will then be going into the operating room, recovery room, operatory room, exam room. And that when doing this, it doesn't matter what the disability is. It's really, you have a problem here. You have a dental issue. You have a medical problem. How can we help you to become better? We don't focus on the disability. We focus on the person.
Health Sciences Faculty Education Project, a resource for health science educators. Project staff: Project Director, Joanne Sowers, Ph.D. Project Coordinator, Martha R. Smith. Dissemination Coordinator, Lisa Ferris, M.E.D. Project Administrative Assistant, Tina Campbell. Additional support provided by Clark Hochstetler, M.A. Sign Language Interpreter, Steve Marcino, CSC. Narrator, Z. Boone. For project information, please contact Martha R. Smith, Center on Self-Determination, Oregon Health and Science University, 3608 Southeast Powell Boulevard, Portland, Oregon, 97202. Telephone 503-232-9154, extension 131. Email smitmart@ohsu.edu. These videotapes were partially supported by grant PR/3P333A900-51 from the Department of Education, Office of Post-Secondary Education. Copyright 2002 by Joanne Sowers and Martha R. Smith. All rights reserved. No part of this material may be reproduced, stored in a retrieval system, or transmitted in any form or by any means without prior consent of the copyright owners. Oregon Health and Science University presents a resource for health science educators. Profiles of health science professionals with disabilities. Dental professionals with hidden disabilities. Frederick Mueller, DMD. Dr. Mueller is a periodontist who graduated from Oregon Health and Science University. Dr. Mueller first worked in a general dentistry practice and later received his certificate in periodontology and has been a practicing periodontist for over 22 years. Dr. Mueller currently owns and works in his own periodontal clinic in Oregon. Dr. Mueller experiences a learning disability that affects him in the areas of reading and writing. Karen Mueller, RDH, BS. Karen Mueller graduated from Oregon Health and Science University with a Bachelor of Science degree in dental hygiene. Ms. Mueller has worked for over 25 years in clinical dental hygiene. She currently works as a dental hygienist and office manager in a private periodontal clinic in Oregon. For the past 13 years, Ms. Mueller has also taught periodontal health care to elementary school children in her local school district. Ms. Mueller experiences a learning disability that affects her in the areas of organization and reading. Robert Rapp, RDH. Robert Rapp graduated from Portland Community College in Oregon with an associate's degree in dental hygiene in 1996. Mr. Rapp currently works in Oregon at 2 dental offices, including as a dental hygiene coordinator at Mid-Valley Family Dental Practice. Mr. Rapp experiences a learning disability that affects his long-term and short-term memory.
I was born in Vienna, and I was pretty much a happy-go-lucky guy, except when it came to classroom work. I was put in the corner many times because I didn't get things. The synapses weren't there. I didn't comprehend things as maybe others did. And I remember times when the teacher would ask me or come up front to the blackboard and solve a certain arithmetic problem, and I couldn't do it. And he would pick me up by the head, rub my nose into the blackboard and say, "Go sit down," or "Go sit over in the corner," and so forth. And that was in math. I think reading, I had the same problems. I just was a very, very slow reader. I always had to use my finger and go along and read very, very slowly. So comprehension was not the greatest either. And I remember many times having to sit in the corner, and while the others were having recess or something, I would have to sit in the corner and with my face against the corner and just sit there for hours.
I was 32 years old when I decided to go back to school for a second career in dental hygiene. While doing the prerequisites my first term in school, I really struggled with some of the science academics, the biology primarily. And I had an instructor that saw me working very hard to do all the homework and do the classwork and so forth, and my presentations were fine. But it was mostly when it came to test taking, the answers were not there. It just didn't work well for me. So she recommended that maybe I had some issue with learning and that I be tested and evaluated for a possible learning disability. Went to the Office of Students with Disabilities for testing, and I was diagnosed with a long-term, short-term memory deficit. How that impacts me is academically with my memorization skills. I need repetitive memorization abilities, such as using flashcards and so forth. Auditorily, I hear things, but I don't grasp them immediately, so it takes quite a bit of work to get it into the brain and keep it in there, keep it active.
I got all A's in college, but then when I got into the professional school, that was a different story. That was like a whole new language for me and a whole new concept. It was an extremely stressful situation. I think that some of the strategies that I probably applied back in school were the determination and the hard work, but as well, I learned to focus a lot on the skills that I was doing. I learned to visualize the dental chart, 1 to 8, 9 to 16, around, and I learned to visualize that with what I was doing and try to place those numbers in 8 sequences, which was easier for me than off the top of my head knowing where 25 was. So I visualized it back to the chart. I also I remember radiographic right-left orientation was really difficult for me. And I do recall sitting the x-ray in front of the patient around their face. And that was the way I could turn, look at the films, and say which tooth was where. as I learned how to do that. Now it's, of course, more automatic, but I do remember visually taking that film and putting it around that patient's mouth. So those are some of the things that I tried to do.
I'm not proud of this, but I have to say it was very seldom that I read a textbook. Most of my college and even dental school textbooks are brand new, barely opened, and maybe the first chapter, because when you start, you're really motivated. You say, okay, I'm going to really get into this. I'm going to read all the chapters just as they say you should. I never did. I took notes. I was actually a pretty good note taker and studied primarily from my notes. I very seldom studied from the textbook. And because most instructors actually said most of your information will come from lectures, so I counted on that, and that's the way I basically went through not only Willamette but dental school as well. Did not read the textbooks. When it came to clinical situations, I just picked things up very, very quickly. Things were demonstrated as to how to do certain clinical things, and it was very, very easy for me. Actually, there I was always envied by many of the students because, gee, Mueller, how come you can do it so fast? How come you're able to do this so quickly? And they would struggle with trying to put, I remember we had to make crowns out of wax or build them up. And I would be finished in 10, 15 minutes, and others would be nitpicking with their thing for an hour, and I would just have a good time and not have to worry about getting those kinds of things done. It just came very quickly and naturally. I am a very poor test taker. My hands sweat. I have butterflies. Just thinking about having to take an exam where I have to sit down and read the questions and answer them, I have a terrible time. And my SAT scores, my dental, pre-dental test scores and such were not very good. Some of my strategies were to, one, look at old exams and kind of look back and see what kind of questions were on those exams.
Reading and test taking, one of the tools that I use and still do is masking, where you cover the rest of the questions or the rest of the test or a separate page in a book if it's a journal or something that I need to really grasp the concepts for work. I cover the page and I read line by line, moving the paper down. That isolates the individual question or the individual paragraph so that I can grasp what I'm reading as adverse to being lost in the blur of words. That's a good tool for anyone. Also, my note-taking and daily rewriting, I would usually in the morning, again, because I'm freshest, I would rewrite the notes for the day from the previous day, rewrite them, make sure they're organized. If I had questions, I'd do my margins, where you write in the margins of identifiable things that I need to look up or ask questions about for clarification. During the time that I was in school, the dental hygiene clinic itself and the faculty were very supportive. One of the ways, or some of the ways, that they helped me to best achieve was early entrance into the clinic. So say our patients weren't expected until 9, I would be in there at 8 o'clock setting up my tray and getting things organized so that when the rest of my classmates came in and the patients arrived, I wasn't having to run around. I was well organized and very prepared and very confident going right into it that I was ready. I knew where my instruments were. I knew what my game plan was. Another thing that we did was the instructors again would emphasize to me what I needed to be doing. You know, if it was just, if we needed to do a certain procedural or 3 or 4 different things, they would keep me on task. They would help me to focus and to achieve the objective for the day or for that time frame. Another thing was re-emphasizing and clarifying again and again and again for radiology. Very abstract concept, imaginary lines, intersecting lines, and so forth, and angles that in my mind I've not quite grasped. I do well with it now because I have my visual aids that help me out. But so they were verbal flashcards for me and very helpful. It's not that the different tools, if you will, or mechanisms that I used put me at an advantage. It put me at an even ability to learn with the rest of my peers. And that's really important to understand. It took me a little while to grasp that it's not special accommodations, it's to make me more able to learn better so that I am successful in the program, which I think for all facilitators and instructors, that's very important, is to help your students to succeed. That's the whole point of the programs, is to teach them.
I remember, and I still do this to date, writing down charts. I tend to be very, very careful. I do it slowly. I do not talk while I'm doing it to the patient or anybody else because I need that full concentration, and I knew that. If I was looking at, for instance, tooth number 3 needs a root canal treatment, I would recheck that chart several times. And then I also began, because my deficiency is numbers sequencing, I think I realized that I had to find an order, and I'm not an orderly person, but I had to find an order, so I always would start in one place and go around the mouth, and that way I remembered exactly where I was and what I was doing, and I never alter that order. To this day, I never alter this order. Medical aid situations, procedures that have been done, very important aspects of conversations with patients are highlighted in the charts. That highlighting is a real key for me because I can go to those, and I probably visually slow down my reading at that point because I know those are the most critical aspects. And that seems to be the case for everyone in the office.
I think one of the important parts about periodontal treatment is you have to be able to visualize things. You have to visualize the end result before you begin the procedure. And I have done this as long as I can remember, and I still do that every single day. Before I sit down, I look at the patient's chart, I look at the probing depths, I look at what I'm planned to do, and I have a pretty good, actually I think I have a very good concept as to what the procedure is going to be like, or what the end result is going to be like before I even start the procedure. And I think I was able to do that really quite well. So I guess in the midst of things, there are strengths and there are weaknesses, and fortunately the strength that I have, I was able to develop as part of my everyday work. I use a lot of visual aids. I use drawings, or I use reproductions such as this to show them where bone loss is and so forth. I use x-rays, I use models to demonstrate how we resolve their problems. And of course I use a lot of paper and pencil, but I also draw things for them. If I explain to them how we do a gingival graft, I will take a piece of paper and draw teeth and gum tissue and how it relates and so forth, so they can visualize what I plan to do.
Thank you. Okay, quite often dental hygienists use what's called bite wing tabs. This is the bite wing tab. Bite wing tabs hold the film in the correct position in the patient's mouth so that we can get bite wing x-rays. So hygienists can easily just insert into the patient's mouth in the correct location, depending on which teeth you're trying to get pictures of. And bite for me, please. Thank you. And quite often hygienists can just line them up. In my situation, where I can't see the bisecting lines between here and there, setting the camera angle correctly and opening the contacts, which is very important to check for small cavities. Go ahead and open. I use a little bite wing holder, which actually has the alignment here. So I bend them so it's a little bit more comfortable for the patient. Okay. So, in order to get a good picture every time, this tells me my angle. Go ahead and bite. And there's no guesswork with this. And since my line angling is not good, we simply line it up such as this, step out of the room, press the button, and we have, open please, a good picture every time. Open contacts. This actually lines it all up so that it opens the contacts on the film itself. So in most cases, or some cases, dental hygienists are able to set them, go ahead and bite please, to the location they need them, and then envision where those bisecting lines again between here and there are. In my case, that's only guesswork. So I use what's called an XCP. This is a posterior XCP. Open please. And then we set it to get the correct angle. Some of the strategies that I use in my professional world have carried over from school and that support me best. And one of them is I arrive early on my own time to get organized and stay ahead of things as the day gets very, very busy. And another item that I use is called I've created an OPS form or operatory treatment form. When the doctor is cruising along in someone's mouth diagnosing different treatments that need to be done, whether it's fillings or crowns or bridges, it's an organized way for me to track what he's saying, and then we flip back over here and chart it in the chart itself with a physical pen. With all the flipping, I have a tendency to transpose numbers and get lost in directionals. So we've developed this sheet here, which is for myself. We just jot down the patient's name and then what needs to be done, such as an operative, which would be a simple filling, or endodontic treatment, or a prosthetic, such as a crown or a bridge replacement. I jot them down and then I go back, slip it into the chart, and at the end of the day, or sometime when I have a break, I take the time to sit down with the chart, put it in the way the charting needs to be done so that it's correct, and then I can double check. This really helps me. It alleviates my own personal stress. It takes me personally a little more time, but it makes it accurate, and it's very important that everything is accurate in a patient's chart.
Patient safety has really not been an issue, or at least I don't find it to be an issue. You have to make sure that if you know that you have that kind of sequencing problem, you surround yourself with personnel that is able to set you straight. So it's a team effort, and I think that's really the key, that if there is a question, we double check. We always double check things, and to make sure that we're doing the correct thing.
I think the professional that has dealt with their learning differences is probably a safer employee for patient safety than one who may have problems that hasn't dealt with them. So I think the openness is important. They know that they have to be more careful with their numbers. They know that they have to read things twice. In learning, I mean, as students learning, they're probably going to see at some point in time and be extremely embarrassed that they wrote something down wrong or did something wrong. That's what I find with students. They don't want to make mistakes. And those mistakes will be learning issues for them. But most people that have dealt with any of this understand. They accommodate for their learning differences and accommodate for what those are going to translate to for patient safety, and are probably more careful than others may be.
Patient safety is a concern for all healthcare professionals. For me specifically, because of my memory issues, I stay keenly aware of patient health care and their health history forms, especially when dealing with anesthesia, which is something we directly do as hygienists in our state. It's a vital importance to not only the patient, but for my integrity as well. And it's something that all healthcare professionals focus on, but again, because of my memory issues, I am hypersensitive to making certain before I do any anesthesia or any procedure that can harm a patient that I've double-checked everything.
Being labeled somehow disabled in a certain skill or in a certain part of function doesn't bother me at this point at all. I know what I've accomplished, and if I was able to accomplish this with some kind of disability, then more power to me. I don't think I have spoken to other colleagues, to other individuals about my learning disability, unless it comes up in conversation where they may say, you know, my son is such and such, or I have had this kind of a problem. I will be very quick in saying, you know, I have the same problem. It doesn't bother me to, I'm not ashamed of it. There's nothing I can do about it. I mean, it's just there. And I'd like to think that being able to talk about it, if the timing is right, is healthy. I mean, it shouldn't be something that you have to hide.
I think because of my learning disability, a very positive thing has come out of it, and that is more compassion for the patients themselves in their ability to, or my ability for them to understand. If someone's frustrated or not quite grasping what I'm explaining to them, I'll take a moment longer than someone else might to make sure that they're grasping what it is I'm talking to them about and how important not only caring for their teeth but their overall health is. And I think that's a direct correlation between my learning disability and understanding my learning disability, because I've been on the frustrating end of it, and I know how disheartening that can be when someone is explaining something and I'm not understanding it. So very often I will take the extra time or take a different approach so that the patient can grasp what it is I'm telling them.
My advice to faculty, and I hate to advise faculty, but I guess some of the things that I have learned in working with students in the dental hygiene clinic is, if you're watching the student and listening, know that the way you say something may not tabulate in every student's brain. You may need to say that differently, show them differently, do something differently to help them to tabulate all of that information. Another thing is to slow down in the directions. Giving people with sequencing problems 5 directions all at once, they're going to remember the first and the last and not remember the middle ones. So by slowing down their instruction, and it's only going to take, these are bright people. If they've gotten into professional school, they're very bright people. But their sequencing is off. It's not the end of the world. So slow down on those. It'll probably only take you once, and they will assimilate that information and not have a problem with it a second time.
For myself, there was a time during the first term in school where I was frustrated beyond belief and stormed out of the clinical setting before we even saw patients. And a professor came after me and she asked me, she said, "What's wrong? Why are you so upset?" And I flipped around and I told her, I'm frustrated beyond belief. What do you do when your best isn't good enough? And she looked at me flat in the eyes and she said, "If you don't give up on you, I won't give up on you." And something that I learned from that, and I've always carried it with me, not only through my professional and my clinical trainings and all the frustrations that come along with academia and clinical boards and life in general, is what do you do when your best isn't good enough? You find somebody that believes in you and you hold on. And be willing to do the work that is required to make whatever your project is or your experience a success. But ultimately it lies within us to do it.
Health Sciences Faculty Education Project, a resource for health science educators. Project staff: Project Director, Joanne Sowers, Ph.D. Project Coordinator, Martha R. Smith. Dissemination Coordinator, Lisa Ferris, M.E.D. Project Administrative Assistant, Tina Campbell. Additional support provided by Clark Hochstetler, M.A. Narrator, Z. Boone. For project information, please contact Martha R. Smith, Center on Self-Determination, Oregon Health and Science University, 3608 Southeast Powell Boulevard, Portland, Oregon, 97202. Telephone 503-232-9154, extension 131. Email smitmart@ohsu.edu. These videotapes were partially supported by grant PR/3P333A900-51 from the Department of Education, Office of Post-Secondary Education. Copyright 2002 by Joanne Sowers and Martha R. Smith. All rights reserved. No part of this material may be reproduced, stored in a retrieval system, or transmitted in any form or by any means without prior consent of the copyright owners.